Our next Ames awardee has spent his entire career serving underserved populations in Africa and San Bernardino, practicing primary care and preventive medicine in 5 different languages. He graduated with both a medical degree and a master's in religion in '69, then later earned a master's of public health from Johns Hopkins University. On the evening of completing his first year in preventive medicine at LLU, he and his wife Danette flew to East Africa, sponsored by the denomination commencing their 17 years of service on the continent. His first responsibility was in Zambia at Mwami Adventist Hospital and Yuka Adventist Hospital for 4 years. Just a year out of medical school, and he was responsible for a 125-bed hospital on his own and was the only physician in a large remote area. Next, he spent 7 years as the director of Tanzania Adventist Health Services in Arusha, Tanzania, where he oversaw a network of 25 to 30 rural health clinics across the country, serving 500,000 patient visits per year. Many were extremely remote and were often the only medical care facility for miles around. The clinics needed stronger coordination, so he stepped in to oversee the finances and guide their growth. Under his leadership, 5 additional clinics were established, all of which he personally supervised, traveling through the Serengeti Game Reserve to reach some locations. He would see waves of migrating animals, including lions and leopards. In Kenya, he served for a total of 4 years, 6 months as the Associate Director of the Pan-African Adventist Health Services in Nairobi, and 3.5 years as Director of the Seventh-day Adventist Rural Health Services in Nairobi. He also served as Director of the Kenya and Uganda ADRA office. In Uganda, he further pioneered rural health services. After returning from Africa, he continued to serve the underserved. He became the Medical Director of the Inland Empire Community Health Center and later oversaw Loma Linda's night clinics. He, his wife, and his brother started the Social Action Community Health System, or SAC, in San Bernardino, located on the former Norton Air Force Base. Loma Linda leased the property for $1 a year for 30 years, with a promise that after serving the underserved for that long, the property would transfer ownership. Reaching that milestone in 2025, the SAC Clinic remains true to its mission and is now internationally recognized. Over the decades, medical record staff estimated his signature appeared more than 1 million times in patient charts. In addition, he has taught primary care to residents in OB/GYN, preventive medicine, family practice, and psychiatry. He has also trained many physician assistants. His awards include being named an honored alumni in 2014. A living example of the preventive health he teaches, he has climbed Mount Kilimanjaro 3 times and run more than 100 half marathons and 35 marathons, including the Boston Marathon. In 2024, at age 81, he completed the LA Marathon. He teaches Bible classes at Loma Linda University Church and volunteers with its Meals on Wheels ministry. He and his wife, Danette, Emerita Associate Dean of the School of Nursing, have 2 children, Todd and Patrice, and 4 grandchildren. His father, Dr. Lewis Hart, graduated with the class of 1949, and his brother, Richard Hart, graduated with the class of 1970. And now, from the class of 1969, please welcome our Ames awardee, Kenneth W. Hart.
I went to Africa when things were very primitive. I came back from Africa before most of the other people who reported or even started medical school. So I'm going to tell you 1 or 2 quick stories about the way it used to be. Okay? One of the most interesting ones, the most unusual experience I had, I saw a lady come into the hospital. This was when I was the only doctor in a 125-bed hospital. I had to do everything. And she came into she was admitted to the hospital by a nurse practitioner. I saw her chart said malaria and bronchitis, and of course everybody has that. You know, that was the day when it was pretty much the condition. And then she was sitting in her bed in the hospital in a very unusual manner. When she had a big old billowy dress, and of course women in Africa didn't wear that kind of stuff. What's happening here? Anyway, to make a long story short, we treated her for a couple of days, I was about to discharge her from the hospital, and her daughter, standing at the end of the bed, said, I think you better get my mother back to do a careful exam on her before, and of course, all the exams so far have been in a big open female ward. She said, take her back to the back of the hospital so you can do an exam on her and see, I think there's something you need to know. I took her back to the room. I said the nurse to take her back to the back and went back to her a little while later to examine her. She had a full-term pregnancy hanging out to an umbilical hernia. So when she walked, she had to hold her uterus with her two hands like this. And when she sat, you know, she had to sit in it. So I said to her, okay, you obviously are, you know, just about term to be delivered. And so I told her to stay in the hut outside the hospital, and when she went into labor, we would help her. Came into the hospital, I got a call about 5 o'clock in the morning, went down to the hospital, and the midwife said, of course we had so many deliveries that no way I could do the regular deliveries. I only was called when there was a problem. And the midwife says, I tell her to push and nothing happens. Well, of course, her muscles are out here and her baby is out there. So I said, okay, you watch. You get ready down there. We checked her. Of course, she's fully dilated and the baby's head's down and everything. So the next time she had a contraction, I just went, whoosh. So how many of you men have delivered a baby? No, I'm talking about pushing it out. I'll tell you another quick story from Africa. Had a patient brought in. It was actually a man who was from England, but he was working in Africa. He was brought in the middle of the afternoon, and he had been bitten by a hippo. And he went right through his leg. Two of those gargantuan teeth. I almost thought I should bring my hippo teeth with me so you see what I'm talking about. All the way through his leg, both sides, and incredible as it may seem, missed the artery, missed the nerve, missed the vein, and missed the bone. Of course, those teeth are fairly sharp, so it went through, I guess it just sort of spread the tissue out as it went through like that. But he still had a problem, so we brought him, and that was the time when I had a visiting U.S. doctor here to help me. So the two of us got ready, we gave him a spinal anesthesia, and we spent 2 hours digging the dirt and the grass and the whatever out of that wound. And 3 or 4 days later, he was fine. His family came to pick him up and took him back to his area. I would like to say a couple of words about all the wonderful things that AIMS is doing. But I think there's something else we need to do. After spending 4 years in in Zambia and working at hospitals there, I realized, you know, so many of our patients go out there, they get the same diseases that they had before, and they come back, and you're in and out, in and out. So I said, what if we really did something at the clinic level? And so I went to Tanzania. I won't go into all the details. The general conference thought I was crazy, that I didn't want to go to a hospital. I went to Tanzania, and I took charge of about 25 hospitals. We ended up with over 30 of those, not hospitals, clinics, rural areas. And we saw 500,000 patient visits a year in those clinics. And every one of those clinics had not only a medical, these were mostly trained nurses that saw the patients and so forth, and other staff, but also a chaplain. We had someone, maybe it was a local pastor or whatever, and so I can tell you now, as a result of things like that, don't say I'm the big responsible person, but I can tell you now that countries like Zambia and Tanzania, because of the work of some of these rural clinics, have more Adventists in them than the entire United States. Amen. Amen. So we need to think more, we need to expand our horizons. We need to be doing work, our wonderful work that's being done in the hospitals. Those hospitals need to be, okay, could we establish a few clinics out here, around, and just see what would happen? Anyway, thank you all.